Dr. Mulasari, the fact that we have alarming statistics worldwide about CVD and the rate of number of people getting affected with cardiovascular disease is increasing. On World Heart Day, what would be the right message to give to these people on what should be done in terms of avoidance or not reaching the stage of where you need to get a severe intervention done?
In everything in life, prevention is better than cure. So what you need is finding out your diagnosis early, doing the basic steps right, which means basically trying to do your exercise, doing your diet, and if required, taking your medications regularly so that your blood sugars are well controlled, your HbA1c is less than 6 or 6.5, your blood pressure is around 120, 130, the top level, and the bottom level around 80. Your cholesterol numbers are good. That means your LDL is clearly below 100, the bad cholesterol number. And basically, you're not overweight. And obviously, avoiding the modifiable risk factors like smoking and excessive alcohol intake. So, this is the clear message that I want to give.
Dr. Mulasari, the other question out here is that if people do experience such symptoms that are very relatable to a heart attack or discomfort in the chest, what would those symptoms be, and what should the people around them, what can they do immediately while they are rushing them to the hospital?
So the first thing is that the chest pain, which is of cardiac origin, is usually a dull aching chest pain, which comes on the chest or in the left side of the chest. It may radiate to the left arm. It can be atypical. It can present like a gastric pain. It sometimes radiates to the back and to the jaw. So it's important that people realize that pain can be very atypical and can be misleading. The most important thing, if somebody experiences a pain which is not usual, which he has never experienced in his life, is to alert either his or her spouse, or to call an ambulance or a hospital where she's or he goes to. If not, at least try to alert your neighbor or somebody to get you to a hospital quickly. This important thing is that time is muscle, and if you don't get to the hospital and get an ECG, your diagnosis may not be correct. So I think the most important thing is to get help. Don't try to self-drive. Don't try to do everything yourself at that point in time. The most important thing is for you to relax and get somebody else to help you with it. Do not smoke. Remove your buttons and make your clothes a bit easy, because you may sweat and be profusely diaphoretic. So you have to be a little bit relaxed when you're going to the hospital. Sometimes it's very difficult because the pain may be quite severe and you may be really uncomfortable with it. The worst thing is to do, as I said, is smoke or drink a glass of alcohol or something like that, which is crazy, because that will worsen the problem. So the most important thing is to get to medical help and get to a hospital where you can get a clinical test done and an ECG done.
Dr. Mulasari, one last question. We do emphasize a lot on taking care vis-a-vis the food that you put in your mouth, exercise, etc., as preventive measures. What role do vitamins and minerals play in trying to prevent heart disease? Do they have a role at all?
Well, vitamins have no role in heart disease prevention. To be very honest, there's popping pills in the morning. It does not make any difference to heart disease. It's very important for us to know that most of the large trials with pills with vitamins have shown no benefit to patients. It's important. In fact, it's the other way around. The pills may increase, the vitamins may increase your appetite and may make you eat more and get into more trouble. So I think in a prescription for a heart disease patient, unless the patient has a specific deficiency, which could happen in a small group of elderly people or diabetics where the B complex may be used because they're B12 deficient, there is no role for vitamins in these patients.
Okay, Dr. Mulasari, one very last question. I'm sorry, but I'm just too tempted to ask. We have noticed of late, and I think a few cases came out during COVID as well, people doing very, very heavy and strenuous exercises, and young people that too faced a heart attack while they were in the middle of their exercise, and they couldn't make it to the other side. What exactly would happens in this kind of scenario, and how can you prevent it?
So there are two parts of the story. One is that you may have had an undiagnosed heart disease, which you may not know, which could be precipitated by severe exercise, which happens to a lot of people. They think that because I'm running a marathon or I'm physically fit, I'm not going to get heart disease. Sorry, that's not true. You can get heart disease even if you're a marathon runner, because it's partly genetic in terms of what you get. So you do some unusual exercises with an underlying heart disease for the first time, you can get into trouble. So that is an underlying heart disease creating a problem. The second is COVID-19 has a peculiar problem because of the vascular involvement, that it clots arteries. And this could be brimming in a patient who's maybe asymptomatic as far as the COVID-19. He may not be having a fever, or he may not be having a sore throat or cough, but he may be harboring an asymptomatic COVID-19, which may be triggering a vascular clotting. And that could create a heart attack or create a lung clotting, which could be very dangerous to the patient. So to put in short, you may have an underlying heart disease precipitated by an unusual exercise, or the COVID-19 could have created a problem which suddenly precipitates during exercise of some unusual form.
Would this have happened to, we heard two cases in the news recently of a young celebrity, an actor who passed away at an age of 40 suddenly, and he seemed very fit when you saw his pictures, and a cricketer who's recently undergone an angioplasty. Would these be cases?
So physical fitness is good, but remember that physical fitness does not override. So the physical part of the exercise has to be very, very importantly not mixed up with the presence of heart disease. So that's the important message I'd like to give.
Okay, Dr. Mulasari, you are very, very short on time, and thank you so much for sparing time. I know that lots of patients waiting for you. Thank you so much for parting this message on World Heart Day. It's very special for people to hear directly from you, and all these tips I think will definitely go a long way in helping people manage their lives. Thank you so much.
Thank you, Vishal. Thanks very much.
हेल्थ, फिटनेस और पोषण पर पाए बेस्ट डॉक्टर्स की राय सिर्फ famhealth.in पर, और हमारी YouTube पेज माय फैम हेल्थ पर सब्सक्राइब करना ना भूलें।